Welcome. Ladies and gentlemen, please stand by. Your webinar is about to begin. Please use the volume control on your computer to adjust the sound for this presentation. Good day and welcome everybody to the inaugural Canadian Obesity Network public webinar series. Today's presentation is Obesity is a Chronic Disease. This public webinar series is an exciting opportunity for the Canadian Obesity Network to interact with Canadians to disseminate credible and evidence-based information about obesity. Through this platform, experts will weigh in on issues in obesity, bias and discrimination, prevention, treatment, policy, and more. If you would like to be part of our public community and want to be first to hear about the future webinars, please become a member at obesitynetwork.ca/public and opt in for our newsletter. An archive of this webinar will be posted and available for viewing on the Canadian Obesity Network website. Due to extremely high volumes of requests to join this presentation, we have disabled microphone and question and answer features. However, we do want to answer any questions you might have. So, after attending this presentation, if you have any questions you would like to ask the speaker, you may do so in the evaluation survey, which we will send out to the email address you used to RSVP. We will post both questions and answers on the webinar page. Now I'd like to pass it over to Dr. Sharma, who will be speaking on why obesity is a chronic disease.
Okay, I think there's a problem on my end with my computer. It just lost the connection. And we're getting back in. It's trying to load the presentation, but I don't see it. Yep, here we go. Well, hello everybody. I'm Dr. Sharma. I'm a professor of medicine and chair in obesity research and management at the University of Alberta here in Edmonton, Canada. I'm also the scientific director of the Canadian Obesity Network, and I'm grateful to the network for giving me this opportunity of speaking to you today. The topic that I'd like to discuss with you over the next 40 minutes or so is the issue of why it is that many of us working in the field today consider obesity to be a disease. Before I get there, I want to share with you a few thoughts on the Canadian Obesity Network itself. Some of you might have been members from the day the network started, which was back in 2006. Since then, this network has grown into one of the largest professional networks of obesity professionals in the world. The vision of the Canadian Obesity Network is to be Canada's authoritative voice on evidence-based approaches for obesity prevention, treatment, and policy. Our mission is to improve the life of Canadians affected by obesity through the advancement of anti-discrimination, prevention, and treatment efforts. The strategic goals are to address the social stigma associated with obesity, to change the way policymakers and health professionals approach obesity, and to improve access to evidence-based prevention and treatment resources. The Canadian Obesity Network has last year launched its public engagement platform, and the webinar that you're attending today is just one of the many activities that the network will be undertaking in providing credible information from Canadian experts to the Canadian public. Now, coming to the topic of obesity, I don't think it would be a surprise to any of you to know that obesity has been around for a long time. What you see on this slide is this little stone figurine called the Venus of Willendorf, which is in the Museum of Natural History in Vienna. And this little stone figure was created probably around 25,000 years before Christ. Now, looking at this figurine, I can tell you that this figurine looks pretty much like the patients I would see in my clinic, which is a bariatric clinic specializing in treating patients with more severe obesity. What this tells us is that severe obesity was around in the Stone Ages, and people back in the Stone Ages were quite familiar with exactly what this looks like. Now, what has changed between the Stone Ages and today is that back 25,000 years ago, there were probably not a lot of individuals around who had this kind of figure. What we're seeing in Canada today, and you can see this on this busy slide, is that when you look at obesity overall in Canada, we have been seeing increases over the past several decades. And alarmingly, what we are seeing in Canada now is not just that there are about 7 million people who are living with obesity, but that there are an increasing number of both adults and children who are living with more and more severe forms of obesity, meaning that their excessive weight gain is far that of what you would see, or exceeds far that of what you would see in the general population. Because, as many of you know, obesity is associated with a number of health problems, the Canadian Medical Association has recently recognized obesity as a disease. In fact, they have declared obesity not just to be a disease, but to be a chronic medical disease, meaning that this is a condition that once people have this condition, we don't really know how to cure it, and we have to start thinking about how to best manage this condition in individuals. And I'll be talking more about that in the course of this talk. Now, the Canadian Medical Association is not the first association or organization to recognize obesity as a disease. In fact, the World Health Organization has long spoken of obesity as one of the non-communicable diseases. The American Medical Association has come out and recognized obesity as a chronic disease. The U.S. Food and Drug Administration agrees that obesity is a common disease, and several other organizations, including the Canadian Obesity Network, have long said that we need to look at obesity as a chronic disease in the same way that you would look at other chronic diseases, for example, type 2 diabetes or heart disease. Those are chronic diseases that once people have them, they pretty much have them for life, and it becomes a question of, well, how do you manage, how do you live with diabetes? How do you live with high blood pressure? How do you live with high cholesterol? Because these are not conditions that we know how to cure, but these are, of course, conditions that we know how to manage, and obesity kind of falls into that category. The question is, why is it that we see so much more obesity today than before? Now, what you see on this slide, and you know, this figure is often referred to as the spaghetti diagram of what causes obesity. What the slide basically shows is that there are a number of issues that interact to influence the prevalence of obesity, or the frequency at which you find obesity at a population level. Now, allow me to break this down for you. Here you see the different domains that are important. Obviously, we've seen huge changes in food production. We've seen large changes in activity environments. We've seen a lot of differences now. There are a lot of social influences that can impact on how people eat and what their belief systems are around food. Food consumption has changed, and this is where you would talk about fast food and portion sizes. We know that individual activity levels have changed, but we've also recognized that there are a lot of factors that work at the individual level in terms of psychology and mental health that impact weight. And of course, there is a complex biology about which we will be speaking more in today's webinar that explains why it is exactly that once you put on the weight, it becomes so difficult to lose the weight and even more difficult to keep it off in the long term. In today's webinar, I want to focus more on the biology of obesity, and we will not have the opportunity today to speak a lot about the societal causes or the environmental causes of obesity, but those are certainly topics that are going to be covered in upcoming webinars. I want to come down to the reality of something that I think most of you are aware of, and that is the fact that most people who lose weight, who manage to lose weight, and it almost doesn't matter how this happens, whether it is through diet or exercise, whether this is you know, by watching what you eat or counting calories or cutting carbs or, you know, whatever the strategy is, there are lots of different ways that people can use to lose weight. The problem is that in most cases, the weight comes back. And in fact, what you see on the slide here is the scientific evidence that comes from 16 studies on long-term weight loss. And what you can see on the slide here is that the longer you follow up people who have been in these studies, the more likely they are to have regained the weight. Some of you might have heard this, that about 95% of people who manage to lose weight, and it pretty much doesn't matter how they manage to do it, at the end up putting weight back on. And that is really one of the big issues. So the question, of course, is, well, why is this so difficult? Because we know that there are some people out there who can do this. And the question that you would ask is, how are people who manage to lose weight and keep it off different from people who lose weight and put it back on again? And perhaps even more importantly, the question is, how are people who have lost weight and are keeping it off keeping it up? What are they doing? So to answer that question, colleagues in the United States have been running something called the National Weight Control Registry. Now, in this registry, they have a lot of members, and they have a lot of people in this registry who have somehow managed to lose weight and are managing to keep the weight off. And the question is, well, what are they doing to keep the weight up? And what you see on the slide here is a quick summary of some of the key things that these individuals are doing. And the first thing I'd like to point out is that most of the people here are not eating a lot. They are living off approximately 1,400 calories. And anyone listening who's ever counted calories or tried to reduce the caloric intake will appreciate that 1,400 calories is really not a lot of calories. Most people who don't have obesity would find it very difficult to live off 1,400 calories. They'd probably be hungry all the time, and they'd probably, just want to eat. So somehow these people who have lost weight and are keeping it off are living off 1,400 calories a day. But here's what's interesting. Not only are they eating 1,400 calories a day, they are also doing about 400 calories of exercise per day. Now again, anyone who's ever been on a treadmill where you count calories as you're running on the treadmill will appreciate that this is not a trivial amount of calories. It takes quite a bit of exercise to try and burn 400 calories through exercise. So if you just, think about it for a second, here you've got people, they're eating 1,400 calories a day. That's all they're eating. And they're burning 400 calories a day through exercise, which means that essentially they're living off 1,000 calories, which I'm sure you'll agree is not a lot of calories. Now, I don't know how these people are doing it, but that's what they're doing. What I do know is that most people, and this probably includes most of the patients that I see in my practice, are probably not going to be able to do this. They are not going to be able to, survive on 1,400 calories for the rest of their life and do 400 calories of exercise every day for the rest of their life, because that's what you're going to have to do. I mean, they even have people in this weight control registry who have lost weight, have kept it off for several years, and when they start falling off their 1,400 calories, which means when they start increasing their caloric intake or when they start reducing their physical activity, their weight starts coming back. So what this slide and what this data actually shows you is just how difficult it is to lose weight and keep it off. Because keeping it off means that you are going to have a very restrictive type of lifestyle. That's what it's going to take if you are trying to keep the weight off. And I'm not talking about people who are trying to lose 5 pounds or 10 pounds or maybe even 15 or 20 pounds. We are looking at people who are trying to lose 40 pounds, 100 pounds, maybe 200 pounds. The more pounds you're trying to lose and keep off, the harder this gets and the harder you're going to have to work at it. And what's important here is the harder you're going to have to keep working at it, because the minute you stop doing anything that you're doing to lose the weight, that weight is going to start coming back. And so that's really the dilemma that we have when we think about weight management. Now, a lot of people, when they think about this, say, I don't get it. Why is losing weight and keeping it off so difficult? Because ultimately, when we look at energy balance, isn't it just a question of energy in and energy out? Isn't it just calories going in and calories going out? And if I can balance the two, I should be able to be whatever weight I want to. And when we talk about energy in and energy out, really what we're talking about is diet and exercise. So there's this idea out there that if I can just control my energy intake by reducing my calories, or if I can just increase my energy output by increasing my exercise levels, try to burn those calories, then really I should be able to control my weight and get to whatever weight I want to be. And that's what a lot of people tell you. That's what you read a lot about in the media. And that's a very popular conception that people have about this. But what you see on the slide is this black box. And it's the black box that makes life difficult, because what you see, what is actually in the black box, what the black box in the slide represents, is a very complex physiology, which is all of the biology in your body, all the hormones, all the metabolic processes, things that affect your hunger, your appetite, all of these things that are tightly controlled. And this physiology is very sensitive to energy balance. So what essentially happens here is that the minute you start trying to lose weight by eating less, or trying to lose weight by increasing your level of activity, trying to burn those calories, this system kicks in and sabotages your efforts. And you know that this happens because this is why exercising helps you work up an appetite. As you start burning those calories, your body wants those calories back, and that's why you're going to be more hungry. The same thing happens when you start going on a diet, and we'll talk about some of these changes that happen. But the bottom line is that if this was physics, this would be easy, because then it's just a question of calories in, calories out. The problem is we're not dealing with physics. We're dealing with physiology, and physiology is all of the physiological processes that your body has to protect its body weight. And the body is very efficient in doing this. And so when we talk about obesity being simple, it's really not simple at all. Now, we know that there's a lot of genetics in this, and we'll talk a little bit more about genetics later in my talk, that controls how the body responds to diet and exercise. But the bottom line in all of this is the fact that when we look at energy regulation at a whole body level, it's pretty complex. It's not as easy as saying, let's just eat fewer calories, or let's just try to burn those calories, the weight will come off, and we will somehow solve the problem. No, what you're dealing with is this very, very complex biology shown here in this slide, and I don't want to go through all of the details here. Those of you, who are health professionals here will probably be familiar with some of the, some of what is shown on the slide, the fact that there are hormones and other factors that are secreted by your fat tissue that come from the stomach and from the gut that affect appetite and all of that. And I don't want to get into that. What I want to make sure that we understand is the fact that you are dealing with a very complex biology that is designed to very carefully monitor and regulate body weight. We are just starting to understand a lot of these signals. So what you see on this slide is just sort of a schematic that reminds us of the fact that many of the hormones that are involved in energy metabolism, hormones like leptin, PYY, insulin, GLP-1, etc., these send signals to the brain that tell the brain, here's what the energy stores are, and the brain responds by sending out these signals that increase appetite, that make you hungry, or after a meal make you feel full. And it's through modulation of all of these different factors that your body usually does a pretty good job of maintaining energy balance. So here are some of the things that the body does when you try to lose weight. The minute you try to lose weight, which means the minute you start, cutting calories or trying to exercise or, try to get the weight down, there's a number of hormonal changes that almost instantly happen. And here's just a short list. There's a decrease in leptin. Leptin is a hormone that comes out of your fat tissue and really is a satiety signal to the brain. So the first thing that happens is that leptin levels fall, which means automatically that you're going to be much more hungry now. And what you also know is that there's going to be an increase in ghrelin secretion. Now, ghrelin is a hormone that actually promotes hunger. And we know that when people stop eating, their ghrelin levels go through the roof. So really, that's what your body does. And of course, you experience that the minute you try going on a diet, because, the key result is you're going to have an increase in appetite. And it's not just an increase in appetite, but it's also an increase sort of in the kind of foods that you're looking for. So when we say it's an increase in appetite, well, it's not just that I could eat anything. No, but you start really wanting to eat things that have more calories. You're starting to look for the pizza Nobody says I'm starving. I could eat a ton of broccoli. People when they're starving want to eat the pizza and they want to eat the fast food. They want to eat the stuff that has the calories. They want to go for the gravy. So we have this increase in appetite. But here's something else that happens, and that is a decrease in metabolic rate. So we all have a metabolic rate, which is how the body regulates all of the metabolism that happens. We are mammals, which means that our body has to be kept at 37 degrees centigrade, and the body has a lot of ways of doing that. Now, when we start eating less, and when we go into the state of caloric deficit, because we're either eating fewer calories or we're increasing our caloric output, one of the things the body does very effectively is it turns down metabolism. And a lot of dieters will experience this because a couple of days into your diet, you start feeling cold. And you might have to start wearing a sweater. Well, that's really your body that's starting to turn down metabolism. But what that really means is that you're now burning fewer calories than before. So if you were burning, say, 2,000 calories before, as you start losing weight, you're no longer burning those 2,000 calories because your body's now trying to save those calories, and you start burning fewer calories because you're trying to compensate for the fewer calories that you're eating. And a direct symptom of that, in fact, is this feeling of cold. And if you do the proper experiments and measurements, you can actually show that as people start losing weight, their metabolic rate drops. But that's not all that happens. Another thing that happens is that the calories that you burn through exercise also decreases. So, what you see is the technical term thermogenesis, which actually just means burning calories as a result of exercise. And what happens when you lose weight very often is that because of these metabolic changes that happen, you become so much more efficient at exercising, which sadly means that you are going to need fewer calories to do the same amount of work. So just to give you an example, if before weight loss you work a certain number of steps or you spend a certain amount of time on your treadmill, you burn a certain number of calories. Well, after weight loss, if you do the same amount of exercise, you're going to burn fewer calories because your body has now become more efficient, which means it can do the same amount of work but burn fewer calories. So what you're seeing here is you're seeing a whole bunch of things that happen to people who try to lose weight. We've got the hormonal changes, we've got the increase in appetite, we've got the decrease in metabolic rate, we've got the decrease in activity thermogenesis. And when you take all of these things together, what it essentially does is it reduces the amount of calories your body needs. So let's assume you're starting out with a body that needs 2,000 calories and you're eating 2,000 calories, and that's, and that keeps you at that weight. Now you're trying to lose weight, which means you're going to eat fewer calories. So now let's say you're starting to eat 1,500 calories. What actually happens is your body starts adjusting to the fact that, wow, there's no longer 2,000 calories coming in. There's only 1,500 calories in, so I got to start turning down the furnace. And your body starts doing that. And these are all mechanisms that it does. At the same time, there's an increase in appetite, which means you're going to constantly be thinking of food and you're constantly wanting to get the food back. And the longer you do this, the more difficult it becomes, and the greater the energy deficit and the more weight you lose, the more your body is trying to get that, is trying to get the weight back. And so the harder it becomes to keep losing weight. Now, from a lot of research that's been done on this, we know, and this is just the title of a paper that's become quite famous in the New England Journal of Medicine, which actually showed that when you lose weight, all of these hormonal changes that I've just talked about tend to persist. It's not that, they're there while you lose weight and then after a while the body gets used to it and then, and then somehow everything readjusts and you can go back to, living the way you did before. That's not what happens. What happens is that all of the changes we've just talked about, they start the minute you start losing weight and they continue till the weight's back. And this can go on for years. We now have, long-term data on people showing that even after years after having lost the weight, their hormones are not the same as in somebody who has never been heavy. No, they are actually still in that same, in the same constellation as you would see in someone who has just started losing weight. So the body, as I say, never sleeps. The body is always going to try to get the weight back. And that is your biggest dilemma. So the problem when you look at obesity management is not how do I get the weight off. because there are lots of different ways to get off. And in fact, I think most of you, listening to this webinar who have weight issues have probably lost weight in the past. And those of you who are keeping it off know that you have to work every day to keep the weight off. Unfortunately, most of you who have lost weight in the past will be in the other group, namely the group who have put the weight back on. And that is the dilemma. So the problem in obesity management is not how do I lose weight. The problem in obesity management is how do I keep the weight off. Now this brings me to really an important point in all of this. And that is the fact that one of the key reasons why we're all different in terms when it comes to our shapes and sizes is that genetics is really, really important in this. And this is something we've known for a long time about body weight and body shape and body size and body composition. What you see here on this slide is work taken from a researcher called Stunkard, who was very famous for having done a lot of twin studies on obesity. And what you can see on the slide are monozygous twins. So the key thing about monozygous twins is that they're identical, which means that they share common DNA. So if you do the DNA analysis of one of the twins, you would find exactly the same DNA structure, or basically exactly the same genes as you would in the other. And monozygous twins, they share the DNA, and often they also share the same environment. Now, as you can see here in these four twins pairs, you can see that there are differences in shape and sizes, and you cannot virtually not tell them apart from behind. Now, they're different. There are some genes that can make you slim, and there are some genes that can make it easy to gain weight, but genes play a big role in this. Now you might say, well, this is largely because these twins are growing up in the same environment, they're eating the same food, they're growing up in the same household, they're the same age, they have the same parents, so of course they're going to have the same body shape and body size. The fact is that when you look at heterozygous twins, these are non-identical twins. They look completely different. So when you look at these pairs of twins here, the difference here is not that they don't share the environment. They're growing up in the same home, they have the same parents, they eat the same foods, but they look completely different. And the reason they look completely different is because they have completely different genes. The genes in two individuals who are non-identical twins are like any brother and sister. So the big difference here is not the difference in environment, which is the same, but the difference in genetics. Now we know, and we know this, we've known this for a long time, and we're starting to learn more and more about it, is that genes really control many aspects of metabolism and many aspects of appetite and many aspects of how the body shape and size and function. And in fact, when we look at all of the chromosomes, and as you'll know, there's, the DNA that we have is distributed across, these different chromosomes. What you see on this slide, if you look at, just pay attention to these red areas, these red marks here. These are parts of chromosomes that have been identified as playing an important role in weight management or in body shape or body size. And what you'll see here is that every single chromosome has such areas. Some of them have more, and that they're kind of spread out across the entire genome. And what this tells us is that there's not one gene that controls body shape or body size. In fact, there are probably hundreds of genes that control aspects of body size, and you would expect that, because if you talk about the complex physiology, if you just think of all of the factors that control things like hormone levels of different hormones, appetite, food preferences, whether or not somebody's a picky eater, whether or not somebody likes to be physically active, all of these things are genetically controlled. And there is a lot of variation in our genetic code for this. And so it's important to understand that there are a lot of, that when we talk about genes or the genetics of obesity, we have to remember that it's not one gene that controls obesity. There are a lot of different genes and a lot of genetic variants in the population that control this. So the question is, well, why are there so many genes that control obesity, and why is it that so many of us, when you look at the population, we all live in the same environment. We all have the same exposure to fast food. We all have the same exposure. We all have desk jobs. We all have busy commutes. We're probably all not sleeping enough, and yet there's so much variability. When you look at people who don't have a weight issue, it's not because all people who don't have a weight issue are eating healthy. No, there's a lot of skinny people who eat fast food all the time and who never exercise and yet never seem to put on weight. And I know from my own practice that I've got a lot of patients who struggle with their weight despite the fact that they try to eat as healthy as possible and they try to exercise as much as they can, and yet they struggle with their weight every day. And it seems that more people in the population are prone to obesity than, or what you might call obesity resistant. So here's a simple way of thinking about this. If you want to ask the question is, why are so many of us genetically predisposed to putting on weight? I want you to think of this from a biological perspective in the way that this is something that we as humans share with pretty much all living organisms. Because one of the challenges you have is, as a living organism, how do you sustain growth in the face of changes in energy intake? One day there's food, next day there's no food, one day there's, special food, and then, one day you have to be physically active, the next day you don't. So there's a constant variation in availability of caloric intake. And that applies to all species. So whether you're a fruit fly or whether you're a plant or whether you're a human, there are going to be variations in the availability of food. And the challenge you have is to sustain growth and sustain the body despite these changes. So what's the program here? How does the body actually do this? And so here's my quick list of things that happen that pretty much guarantee our survival. The first one is, eat whenever food is available. So anytime you're in front of food, anytime food is available, most of us have this urge to eat. It's very hard to resist eating when you're constantly surrounded by food, especially if that food is, looks good and we know it's tasty. So because it's almost like we're genetically programmed to eat food when it's there, because that will really help with survival. And it's not just that you want to eat, you also want to eat as much as possible. So, it's very hard to find the point when you're eating to say, okay, I've had enough. If the food is, if the food is good tasting, and maybe if you're in good company, you want to eat as much as possible till you really feel full. And that's why most people, when they have, unlimited access to food, they'll very often tend to overeat. And here's also what happens is that we tend to eat pretty fast. Now, those of you who have dogs, for example, will know that dogs essentially inhale their food. It's very hard to get them to actually slow down and eat. Well, there are a lot of humans of that we're eating as fast as possible. And we're not just eating too fast, we're also not paying a lot of attention to what we're eating or how much we're eating. And we tend to go for energy-dense foods. And a lot of these things especially happen then when we're hungry. So when you're not hungry, maybe you can resist food. When you're not hungry, yes, it's easy to say no. And when you're not hungry, maybe you might, just want to nibble on your food. Maybe when you're not really starving, you'll order the salad. But the minute you're starving, or the minute that your body is actually hungry, it becomes very, very difficult to do any of those things. Here's another thing with regard to physical activity. Now, a lot of people like being physically active, and being physically active is good for you, and we've known this forever. And there's a lot of people out there who really feel good when they exercise. Unfortunately, there's also a lot of people out there who don't feel good when they exercise, and exercise is just not something that they like doing. And again, you could say, well, that makes sense, because why would you exercise? Exercise is not a very useful activity. It's not a utilitarian activity. Now, if you're shoveling the sidewalk, well, that you need to do. That's something you need to do. So when you're out hunting for food, that's something you need to do to survive. When you're running from an enemy or you're fighting, well, that's something you need to do to survive. Those are useful activities. But running on a treadmill is not a useful physical activity. It's some people will look at that and say, well, what exactly are you doing? You're not even going anywhere. So this notion that exercising for fun is not something that a lot of people actually enjoy doing. I mean, some people do, and that's good for them, but not everybody enjoys that. And you could almost blame genetics for this, because it makes a lot of sense from a genetic point to actually not move when you don't have to. So if you're not hunting, if you're not fighting, if you're not flighting, then just sitting there quietly, peacefully, is actually a very sensible thing to do. And we have some data showing that in a lot of, in a lot of, people, even in hunter-gatherer societies, when you're not hunting and you're not gathering, then what people do is they're not out there exercising and running for fun. No, what they're actually doing is they're resting. But here's another thing that I think we are all genetically programmed for, and that is what I've talked about before, is that when we reduce food intake, your body automatically responds by reducing energy expenditure. And that's not something that you do, but that's something that most of us are genetically programmed for. And this comes back to what I said earlier, is that when you start trying to lose weight, you eat less, you try to be more physically active, what happens is your body starts turning down the furnace, you start burning fewer calories, because that's how your body responds. So when you take all of this together, what you have here is a genetic program for survival. If you go back a couple of hundred years, and this is what your body did, your chances of survival were great. In fact, if you didn't have this genetic program, your chance of survival, would really have not been all that good. Now, unfortunately, the environment has completely changed. Today, we live in an environment where we're constantly surrounded by food. Food is always available. We can always eat as much as possible. There are lots of pressures on us to eat as fast as possible. We are constantly surrounded by energy-dense foods, and most of us have jobs that do not require physical activity. So we're not forced to be physically active to do the things that we need to do. So physical activity today really becomes a matter of choice. What that means is that something that used to be a very sensible program for survival has today become a genetic program for obesity. And unfortunately, most of us have this genetic program for obesity, which really works against us when we live in the current environment, which means that the more you are actually fit for survival, the more you have all of these genetic pressures working on you, the more prone you're going to be to obesity, which means that not only does your risk for obesity go up, but as it turns out, your body is also going to do a much better job of defending that obesity or defending that high body weight, making it even more difficult for someone who's genetically programmed for obesity to lose the weight and keep it off. And again, we know that there's a lot of genetic variance here. For some people, when they go on diets, the weight just comes off. And some people, they go on diets or they do exercise and not much happens with their body weight. So there's a lot, and again, we know that a lot of those differences are genetic. So it's important, this entire discussion, to not forget that when we talk about obesity, we are talking about something where genes are extremely important, and it's the genes that we have when placed in our current environment that richly then translates into this high risk of obesity and these large numbers of weight gain that we're seeing in the population. What does all of this mean for obesity treatment? What this means for obesity treatment is that we have to think of obesity management in the long term really as a two-phase piece. There's the first phase, which is the weight loss phase, and that's not the hard part in weight management. That's what everybody has done. You go to any commercial program out there, you do any fat diet. In fact, just start counting calories or just, stop eating for a couple of days and you lose weight. That's the easy part. That's not the difficult part in obesity management. The problem is the second phase, and that is trying to keep the weight off. Because it doesn't matter how you lost the weight, whether you lost it quickly or slowly, or you cut carbs, or you cut fat, or you did exercise, or it doesn't really matter what you did to lose the weight. The problem is that when you stop doing what you did to lose the weight, that weight comes back. And basically what this means is when you stop the treatment, the disease comes back. And that is the problem with obesity, because the things that you have to do to try to lose weight generally are so restrictive and so difficult, and your body is trying to do the opposite because it's trying to defend its body weight, that keeping the weight off in the long term is really where the struggle in obesity is and where the struggle happens, and explains why it is that the Canadian Medical Association and all these other organizations have now said that we have to look at obesity as a chronic disease, because this is not different from any other chronic disease. When you have diabetes, it's not just a question of how do I bring my blood sugars back to normal. The question for someone with diabetes is, well, after I've brought the blood sugars back to normal, how do I now keep them at normal? And that's where you need long-term treatment, right? So we don't treat diabetes for a couple of weeks or a couple of months. No, it's pretty much a lifelong diagnosis. Some people who have diabetes, they have to treat their diabetes or manage the diabetes pretty much forever. And you could say the same for people who have high blood pressure. Once you have high blood pressure, it's not just a question of how do I bring the blood pressure levels back to normal, but the question then is, well, how do I keep them at normal? And there we know you have to continue the treatment. So let's say you come into my office, you have high blood pressure, and I start you on a medication to lower your blood pressure. Well, you're going to have to be on that medication pretty much forever, because the minute you stop taking the medication, what happens? Well, you stop the treatment, the disease comes back. And it's important for us in the context of obesity to recognize that this is what the Canadian Medical Association means when they say obesity is a chronic disease. It means that this is a disease that is going to require lifelong management. It's not enough to think about how do I get the weight off. It's really about thinking about how, once I've got the weight off, do I keep the weight off? And that's where, unfortunately, we know that simply trying to do this with diet and exercise is so challenging, because your body is going to try to get the weight back. Which takes us to the final dilemma and saying, well, what are the treatments that we have for obesity? Now, unfortunately, and I can honestly say this is the most frustrating piece of being an obesity doctor, is that we don't have good treatments for obesity. When we look at typical treatment success of lifestyle interventions, which is behavioral modification, so you're taking people, you're trying to change the way they eat, you're trying to get them to count calories and maybe walk their 10,000 steps and, and practice mindful eating and all of those things, we know that on average, if you can get 5 or 10%, if you can get a 3 to 5% weight loss sustained over many years, then we have done remarkably well. Now, that doesn't sound like a lot of weight loss, because if you think of this, a 5% weight loss for someone who's 200 pounds is only 10 pounds. That means it still leaves you at 190 pounds. Now, with diet and exercise, we would actually consider that to be very, very successful. If you can do diet and exercise, lose, say, 10 pounds, and keep them off by continuing your diet and your exercise for the next 5 years and keep that weight off, you're actually doing pretty well. And we also know that there are lots of health benefits of doing that. But unfortunately, for a lot of people, that might not be enough. 10 pounds might not be enough, to really improve your diabetes or really get rid of the joint pain or get rid of your CPAP machine. You might need more weight loss than that. Now, unfortunately, the only other way that we know that patients have a good chance of losing a lot of weight and keeping it off. Remember, we're talking about keeping it off. We're not talking about what happens on The Biggest Loser, where people go in and they do a ridiculous amount of physical activity and, and they have a personal chef who cooks for them, and then they lose these huge amounts of weight, and then they go off the show and they put all the weight back on, as we know happens to almost everybody who's been on that show. So that's not what we're talking about. We're not talking about how much weight can we lose. We're talking about people, how can I lose a significant amount of weight, 50 pounds, 100 pounds, and keep it off in the long term so that 5 years later, 10 years later, I'm still keeping the weight off. Now, unfortunately, the best treatment that we have for that is bariatric surgery. And I say unfortunately, largely because I'm not a surgeon, so I don't do surgery for obesity on patients. Our clinic does it, but I don't do it. But there we do know that chances of success are better, far better, in fact, than anybody trying to lose that amount of weight with diet and exercise alone. They still have to do behavioral modification, because once you have your surgery, you still have to change the way you eat and you have to increase your physical activity and all of that. But if you do all of that, your chances of losing and keeping weight off are much better than if you're doing this with diet and exercise alone. But even here, the average weight loss is only about 20 or 30% from where you started. So here in this case, let's say, again, you're starting with someone who's, say, 300 pounds. They lose 30% of their body weight. Well, that still leaves them at 200 pounds, which is still big, but it's a 100-pound weight loss, and the chances of keeping the 100 pounds off with surgery are far better than they would be without the surgery. Without the surgery, this would be a constant struggle. The problem with surgery, however, is the fact that there are far too many people out there who would need surgery. Currently Canada does about 10,000 surgery a year. There's about 1 million Canadians right now who probably need surgery. So at the rate of surgery that's happening here, we would probably just need about 100 years to do everybody. So it's not realistic, right? It's not realistic, this notion that we can just do surgery on everybody. In fact, it's even difficult to just do surgery on the people who need it the most. We don't even have the capacity for that. So the question then becomes, well, if diet and exercise is not enough and surgery is not available, what do we do for everybody else? What are the treatments that we have available? Now, unfortunately, we don't have a lot of treatments there. And so this is where we talk about the therapeutic gap or the treatment gap. So we've got diet and exercise, which is, gets you 3 to 4 to 5%. That's great. And then we have surgery that gets you to 20 to 30% of your weight loss. But then there's nothing in between for most people. So the question now is, well, how can we possibly fill that gap? And I can tell you that the only possibility that I see of filling that gap is in the same way that we fill that treatment gap for other diseases, and that is through the use of medication. Now that might sound okay. Now for a lot of people would say, well, why do we need medication for this? Well, you need medication for treating obesity for exactly the same reason that we need medication for treating high blood pressure, where we have hundreds of medications, for the same reason that we need medications to treat diabetes, or we need medications to treat high cholesterol. For exactly the same reasons, we are going to need medications for treating obesity. The problem is we don't have those medications. When I have a patient in my clinic who has diabetes, I've got 30 different medications to choose from. I have somebody coming to my office with high blood pressure. I've got 100 different medications to choose from. Someone has high cholesterol, I got 30 or 40 different drugs I can choose from to treat their high cholesterol. For obesity, we have virtually nothing. In fact, when we look at drugs for obesity in Canada, we've got one drug that's been around for about 15 years. Not a lot of people use it. It's also not the most effective drug. It works for some people, but doesn't work for most people. And then we have a new drug that has just been launched in Canada in September of last year. It's a very effective drug, but it's a drug that comes as an injection. It's a hormone. Basically, the hormone is GLP-1, which is a hormone that's made by your gut and affects hunger and satiety and reduces the amount of food that you eat. But it's a hormone, which means it has to be injected, and it's not cheap, right? There's a certain cost to it, so a lot of people might not even be able to afford it. So it's not really solving the problem here. So till we come up with better medical treatments for obesity, we are going to continue having this treatment gap, which we need to address, and which hopefully, ultimately, will get filled. And I'm very optimistic about this gap ultimately getting filled, because we have been, I remember the days when we didn't have good treatments for high blood pressure. I'm very aware of the times when we did not have good treatments for high cholesterol. And I certainly remember the days when we did not have good treatments for type 2 diabetes. But treatments for all of those conditions have improved. We've got a lot of new drugs now for treating diabetes, and they work, and we're starting to see really good outcomes with those drugs. We don't have that for obesity. But if you think of obesity as a chronic disease, then that is certainly something that we're probably going to need in the future, and hopefully, we are going to be able to do the research that will lead to better treatments for obesity. What do we do in the meantime? In the meantime, I think as a first step, we have to recognize that obesity is a chronic disease. And what this really means is that we have to use the principles of chronic disease management for managing obesity. Now, the Canadian Obesity Network has published a number of resources. One of the resources seen here on the slide is the 5 A's of obesity management, which is it's a simple guide for family doctors on how to approach patients with obesity, how to ask the questions, how to do the proper assessment, what advice to give, how to agree with the patient on what the treatment goals are, and then to help the patient do this in the same way that you would actually work with patients for any other chronic disease. So really, one of the things that we have to recognize is that obesity management is chronic disease management. Now, we don't have the best treatments, and I hope we will have more treatments in the future, but there are still a lot of things that we can be doing in the meantime to make the life of patients who have obesity easier and to provide them with the best care that we possibly can using the model of chronic disease management. And as you see here, in the schematic, when we ask and assess and advise and agree and assist, it really goes around in circles. And what this really shows us is you're never done with obesity management, in the same way that you're never done with managing someone's diabetes. You manage someone's diabetes and the glucose gets better and it's controlled, but you're still going to have to come back, and I'm still going to have to see you again. Maybe it's in a couple of months, maybe it's next year, but I'm still going to have to see you again. And the same goes for people who have high blood pressure or heart disease. You're never done with the treatment because the treatment is going to have to continue forever. And that's really what is symbolized here by the circle. so the disease management circle for obesity is no different from the disease management cycle of any other chronic disease. And that's really important to understand because that, unfortunately, is not the way that most people look at obesity. They tend to look at obesity as something that, I'll do a 6-week course, or I'll go on a 5-week diet, or maybe a 7-day diet and try to fix the problem. That's not how you fix a chronic disease. Now, having said all of that, I want to come back to the key points. Here's what's fundamental to our thinking about why obesity is a chronic disease. And that's the fact that once obesity is established, and we haven't talked about all of the reasons why someone might gain weight. We've talked a little bit about genetics, and we've talked a little bit about the environment, and you will have other webinars that will focus on some of those issues, on why it is that some people gain more weight than others, and what are all the drivers of weight gain. So we haven't talked about that. Fact is, it doesn't actually matter, because once you've gained the weight, for whatever reason, this now becomes a chronic, often progressive disease. What the word progressive means is that for many people, unfortunately, it's not just that they put on the weight and they're big, but that over time, they tend to get even bigger. And even the ones who don't seem to have a lot of health problems from their size, if you wait long enough, tend to start getting those problems. And so this is sort of the classic definition of a chronic progressive disease. And that's not special, because most chronic diseases, when you look at diabetes, when you look at chronic kidney disease, when you look at chronic heart disease, most of these chronic conditions tend to get worse over time. But fortunately, we have ways of managing them that at least can slow progression. Now, the reason it's a chronic disease, and we've talked about this, is that there are, in fact, complex neuroendocrine factors that will defend against weight loss and will promote weight regain. And so the challenge in obesity management is not how do I get weight down, it's how do I keep the weight off. And that's really where you're up against your own biology that's trying to always get your body back to where you started. And that's really what makes this sort of a lifelong problem. Why is it important that we recognize obesity as a disease? Well, I think the first thing is that recognizing it as a disease can help reduce the bias and stigma of obesity. Those of you living with obesity, I don't have to tell you this, that there's a lot of weight bias, there's a lot of discrimination that happens every day to people living with excess weight. And recognizing that this is not simply a matter of poor lifestyle choices, or people not getting it, or not being motivated, or not having enough willpower. No, we are talking about having a chronic disease has the potential to reduce bias and stigma. We also, by recognizing obesity as a disease, now need to ensure that health professionals understand what obesity is and address obesity in the same way that they would address any other chronic disease. Unfortunately, as I've said, our treatments for obesity are extremely limited. I'm not talking about ways to lose weight. There are lots of ways to lose weight. When I talk about obesity treatment, what I'm talking about is long-term treatment of obesity. So treatments that you can go on, that you can be on pretty much for life, because anytime you come off the treatment, the weight's going to come back. So we need to find treatments for obesity that patients can be on. For that to happen, the treatments have to be effective, they have to be safe, and they have to be affordable. Unfortunately, we don't have that in obesity. We don't have treatments that are effective enough. We don't have treatments that are well tolerated, and certainly cost is going to be an issue. And so there's a lot of work that needs to go into finding better treatments for obesity. And for the few treatments that we do have, like I said, there is a new drug for obesity in Canada now. We do have access to bariatric surgery in Canada. We do have a number of programs out in the community now that will help people with diet and lifestyle and exercise and mental health. But we need to improve access to those treatments. Not just for a couple of days or a couple of months or a couple of weeks, but really patients who have this because they have a chronic disease are going to need this support pretty much forever. And so we have to think about how we want to do this in our healthcare systems. This is where you get to play a role, because the Canadian Obesity Network is the organization. It is the voice of people in Canada who are either as professionals working to research obesity, find better solutions, find better ways of preventing obesity. And I can tell you there's a lot of excellent obesity research happening in Canada, although I would argue perhaps not enough. I can tell you there's way more research going on in heart disease or in cancer or in a lot of other disease areas than there is going on in obesity. But we do have some of the best obesity researchers in the world working right here in Canada, and we need to support them and make sure that they have the resources to do the kind of work that needs to be done. If you're a member of the public, you also have a role because we need your support. We need your support by you learning about obesity and telling and talking to people about obesity, because if you want to find solutions, we have to get other people to understand what obesity is. This is not simply a matter of people not having enough willpower. This is not simply a matter of people having, you know, poor eating habits or you know, not moving enough. We are talking about a very, very complex chronic disease that needs to be prevented and that we need to find better treatments for. And I think your public support for this is not only going to help you learn more about this condition and hopefully help you manage your own problem, you know, better and seek the kind of help that you need, but also allows you to talk about this problem to your friends, your family, your colleagues in a more sophisticated way, you know, based on what the best evidence is. So I encourage you, if you're not already a member, to go to the Canadian Obesity Network website. You know, if you're a professional, a researcher, a policymaker, decision maker, even student who has an interest in this, you can join the professional website. If you're someone who's living with obesity or someone who just has a general interest, we have the public website where you can also join the Obesity Network by subscribing to the newsletter that comes out with information about obesity. Show your support. After joining the Canadian Obesity Network on the website, I want to mention that there's also a Facebook page which is very rapidly growing. There's well over 2,000 people now who have liked this page, and it was just launched in December. And you will find a lot of links on this web page to articles that are relevant about obesity, whether this is new science, whether this is new programs, whether these are things that are happening in your community. You will find a lot of that information on this web page. And finally, some of you might know that I also write an obesity blog. It's called Dr. Sharma's Obesity Notes, and you can find this either by just Googling Dr. Sharma and obesity, or the website is drsharma.ca. And I try to post my views on obesity and some of the more interesting developing research as it emerges. I write a lot about those type of topics on my blog. So on that note, I'd like to thank you for taking the time to attend this webinar. The webinar will be posted and will be available on the Canadian Obesity Network website. You will have the opportunity to ask questions in the survey that follows this webinar, and I will try my best to answer those questions. So thank you again for your attention, and hopefully I will